much.
Thank you, Jura. Always a pleasure to be represented South America. I'm glad to see some people of Chile. I've talked with someone else from South America. No? Okay, well, Brazil is a huge part of it, but it's not the only representative. So each country has their own needs. So here I will show you our perspectives and how we work as advocacy patients from MPN patients. So only an overview of Abrale. We represent an amount of 23,000 patients with blood disease in general. This was the number of patients registered in our databases. We follow these patients during their treatment, the drugs. We have all covered by a system. And we are formalized as an NGO in 2002. And it started, I think, most of ours started was a patient's interest in to change things and to develop new strategies and policies to guarantee treatment access. So we started this work in 2002 and are very proud of the path we work and the achievements we have. Our mission, as was told yesterday, the importance to have something to push you and to work it. Our mission is to mobilize partners and offering systems to guarantee the collaborations to provide accessible treatments for the bloody disease patients. So unfortunately, treatment access is our main issue in Latin America. The drugs didn't arrive, and when it arrived, has all the bureaucratic to be accepted to the government to be registered. So that's why we work as advocates. The main part of it was to guarantee the patients have the quality of life and best treatment. And our work are developing more informing pillars, educational, so we have educational actions. We do a lot of materials and chat with patients. Other one is research, like we're starting to use data, we're starting to collect it to well understand where our patients are, what their needs, and how we can collaborate it with the government by using data. So we have a research department right now. Other pillar is advocacy, so how we can insert in public policies, how can we change our patients' treatment and life quality expectation. And the other one is patient support, like we care about our patients, we welcome them, and all their needs, we are here to provide it. So here is an overview about our MPN patients registered. So nowadays in our database, we have 4,700 patients. And in the total, divided by these three diseases, we have more essential thrombocytopenia patients registered, but our action that we'll present, we're more focused on myelofibrosis patients because as we see, the doctor told us they are more the urgent to need the treatment started as soon as they discover they have the diagnosis. So this is our main challenge we're facing in Brazil, and our patients mostly are located. So the lack of knowledge about the disease is one main challenge that we overcome about educational awareness campaign. We have a straight work on that part to get them know what is happening in the disease and everything. Other one is access of exams and consultation with specialists. Like the specialists are focused more in the south area of the country. So most of patients have to migrate. That's why 60% are located in São Paulo region because there are the specialists are and they needed the consultant and specific exams that almost develop only in this area. So the transportation is our issue that we try to overcome. Other thing, as I told you before, the medication is not available for the public system. Like our constitutional is very welcome. Patients, like in the law, everything is right as well, that everyone has right to treatment for free, but it's not what happens daily. So this we work it based on the law that guarantees patients access medicine. And the lack of space in hospital to perform bone marrow transplantation, as we heard the doctor told, is a very delicate procedure. It must be a lot of specialists involved, and unfortunately, we don't have room for all the patients that has this prescription. So we always fight it in pro of these patients to guarantee that once they have the prescription, they could do the treatment, they could do the blood transplantation, the marrow transplantation. So regarding the awareness and the educational actions, I show you a bit of things we do it regarding of this. So awareness campaign is most focused on printed materials to put this information where patients could have access. The private patients who treat in insurance systems or in the public systems, they receive these materials we put on in the hospital, in the clinicals, in the practice. And it's focused on patients, so the language is easier, the information is validated by the doctors, but in a way that can well understanding, and the patients could really be empowered of what the knowledge they are receiving and get to know what they are understanding. And we also, as awareness activity, we try to mobilize the community by showing how important it is to learn. So we mobilize media and famous people to talk about this disease, and this means that we can't talk about cancer in TV or can't talk about rare disease. So we have this effort to open minds of people that it's important to discuss. And this is some materials made it as awareness. And our main activity as advocacy patients are focused on our participation in the National Health Council. It's a government issue that's reunited monthly to talk about the next steps on the health system disease. And we are glad to, since 2010, represent patients' voice in this room of decision. So in Brazil, it takes more than 1 year a drug to be approved to start it to be commercialized legally in the country, and it's too much time to wait. So what we achieved last year was to register the JACAV in the public system so patients can have access for free. We achieve a first step that to allow it to patients to have it as a legally way. But now we are working efforts with the government to put its disposal in the public system. Like you can buy it by yourself, but the government should bring it to you as a treatment defending the rights patients. So we are focused on that, and the next steps is to open this whole of list of medicines that are covered by private insurers and public system to involve these new therapies that is better for the patients, not only the caregivers they are disposal right now. We should use that space we have in the government's instance of decision makers to guarantee patients' right of the treatment. And this is what leads us. Our work is 100% of effort, whereas 1% of chance. So we work that way. We are proud of to protect our patients' rights and fight with them. Thank you.
Question?
I have a question for you, Fernanda. Okay. Knowing the work that you do, can you relate also to the availability of clinical trials in Brazil? Because one way of access to drugs is by joining a clinical trial. Can you tell us what's happening with the clinical trials in Brazil?
Unfortunately, the bureaucracy of open a clinical trial push away most of interesting companies to develop in the country. So unfortunately, we didn't have that much clinical trials open. And if they're open, they are not well displayed to the community. Like the doctors didn't invite their patients to participate on the trial. They fear to lose their patients for the trial. So we have a lot of issues regarding this that is something we try to overcome by talking with the doctors and our campaigns. If some patients come out for us, one of the services we offer is second opinion. So if he's not well satisfied of the treatment they're receiving or the diagnosis they have, we try to search new opportunities for them, and trials are one of these. But unfortunately, for bloody disease, is not that well received. The bureaucracy push away so this trial, so it's not that easy to put it. We achieved to put some patients in trials, and we tried trials that developed in other countries that the profile matches, but it's still baby steps working on clinical trials and research in South America in general. It's not only a Brazilian problem, it's a South America problem. We are trying to overcome this challenge. No, thank you.